light box for the doctor. You're going to use the HVE, saliva ejector, and air water syringe, mouth mirror, explorer, and cotton pliers. You've got your gauze and cotton rolls. The rubber dam is optional. I'm going to go ahead and place topical. Doctor will place the local anesthetic. While the patient's getting numb, you'll check the shade guide and select the shade for the composite filling. The mouth block or bite block is optional for patient comfort. You'll use the high-speed handpiece with doctor's choice of burr to open up the tooth. If you get too close to the nerve of the tooth, you'll use the slow-speed handpiece with the contra angle and a latch-type burr, not that one, latch-type burr to go in and clean around the nerve of the tooth. Okay, then you're going to use the spoon excavator to clean out any debris or decay. Then you're going to go in with the hand carving instruments. This is the straight chisel, the Wiedelstadt chisel, the bin angle chisel, the hatchet, and the gingival margin trimmer. Once the doctor has refined the prep, if you're close to the nerve of the tooth, you'll use the Dical, which is calcium hydroxide, to insulate the tooth. If you're doing an interproximal filling, you'll place the clear matrix and wedge. Then you're going to etch the tooth. You're going to rinse it and dry it and apply the bonding agent. If it is a light curable bonding agent, you will use the light cure to cure it. Then you have your choice of different kinds of composite. You have the unit dose composite with the syringe with the bulk type composite. You just dispense some out and cut it off, put it on a paper pad. Then you have your flowable composite, which mostly is used as a liner or on very small composites. And you have your plastic instrument for placing the composite filling. You may use a Woodson with the composite blade on one side and a condenser on the other. Thank you. To pack the filling, you're going to do several different layers. So you'll do the first layer and pack the composite in there and light cure it. Then you'll place another layer, light cure that, and the last layer you won't light cure until you start carving, so you'll use the acorn burnisher to carve the occlusal areas. You'll probably remove the matrix if you've placed a matrix, and then use a ball burnisher. This is a football burnisher to burnish the tooth and smooth it out. And then when you're done with that, then you will use the light cure and light cure it. Then once you've done all that, doctor will check the bite. If it needs to be adjusted, he will go in either with a high-speed handpiece with different types of diamond burrs or finishing burrs, or a slow-speed handpiece with polishing points or finishing discs, different types of finishing discs. Okay, once he's done that, he'll check the bite again. If it's fine, you won't need anything else to do. He'll use the floss to check the interproximal areas. And you may try an abrasive strip or finishing strip to smooth the interproximal walls. And you're going to release the patient and set up your next appointment.